Shanti, guys, can you hear me?
Yes.
Okay, last thing. So let's start the session with the one-time Om and Shanti Shanti. Come into the sitting posture. Keep your back, neck straight, align, relax. Gently close your eyes. Take a deep breath. Inhale for the Om. Om. Shanti, Shanti, Shanti. Feel the vibration sensation. Join your both palms. Wrap your palm. Place on your eyes. Very slowly while blinking, looking at your palm, gently open up your eyes and say Om Shanti. Om Shanti, guys. Welcome to the Ayurveda and therapy class. So, quick reminder, anybody? In yesterday class, we have completed the Mitaha, how to eat food according to the three dosha, food according to the position of the sun. And we also discuss about how to eat it, right? And how to cook the food. We discuss about it in detail. And even if you do not understand which food go with what kind of dosha, it's okay. Follow the position on the sun. That would be the best way to have your meal. Okay. But sometimes if you feel heat in your body, you feel so hot. Try to avoid the spices, and if you feel cold and something like that, that your symptoms basis, right? Try to change your diet. If you feel cold, it means you require the hot spices, and if you feel hot, then you require the cold spices. So according to that, you can moderate your diet. You don't require the deeper understanding, yes, but being a yoga therapist, you require the deeper knowledge of everything. But for just helping yourself and helping, um, just giving the little bit support to your family and the other person, your students, you don't require much, deeper information related to the Ayurveda. That's totally fine. Some people they want to know that how they can figure out which personality they are, and they have the combination or the one kind of dosha personality, but actually you don't require to go into that thing. Okay, it's just for the general idea about it. Okay, so you get a little bit idea about it, how Ayurveda work, um, and provide you the health. So now we talked about the therapy. From today we're gonna start the therapy, how you can help the people around you and yourself and your family members with the general things. Okay, so I'm gonna talk about it, general ideas about related to the problem from now onward. So today problems are all kind of, especially the arthritis. Arthritis, I think all of you are familiar of the arthritis is inflammation of the bones, right? And other bones related problems we're going to discuss about it, either it's osteoporosis, inflammation in the bone, or cancer of the bone, or your bones are weakened or not having the enough strength. So through the diet and through the asana practice and through the other meditation and shatkarmas, pranayam, how we can provide the treatment to these people who are suffering with problems. So yoga therapy basically including everything, Yoga therapy means using the yoga as a treatment. It's the meaning, right? So yoga work on the three aspects. Yoga therapy work on the three aspects. I'll write it down for you. That is so Shakti Karma. Write it down. The yoga principles, or how the yoga therapy basically forms. So basically, little bit history of the yoga therapy. It's originated in 1970s, okay, in the France by Dr. Bernard Oriol, and the five main pillars of the yoga therapy. So, pillar of the yoga therapy is mm, understand yoga therapy means the treatment which is we are giving to the any person with the help of the yoga and the Ayurveda also, which include lifestyle, diet, and how they are having the relationship with other, their physical activity, their spiritual, emotional health. Understand when very first class I talked about the meaning of the health. So actually, overall health we're gonna consider here. Okay. So now yoga therapy have three perspectives. Three perspectives. One is Shakti Karma. Just it will give you the idea who can practice the yoga therapy. Shakti Karma. So second is Chikitsa Karma. So Chikitsa Karma. Note it down and then I'll explain. Third is Adhyatma. It is M. Adhyatma Karma. Three perspectives of yoga therapy. Shakti Karma Chikitsa. So pronunciation is Shakti Karma Chikitsa Karma. Oh, okay. I'll type in the box, but problem is that then it would not be recorded. And the people who are watching the video later on, it's become difficult for them to understand. So I'll spell it again. Okay. SHAKTI Shakti Karma KARMA Shakti Karma. Okay. Then Chikitsa Karma CHIKITSA Chikitsa Karma KARMA. Adhyatma Karma ADHYA KARMA Adhyatma Karma. But in whiteboard, there's no typing. Otherwise, I would be typing here. So I wouldn't see any typing option here. But in chat box, if I'll go, so I'm gonna lose the whiteboard. That is the issue. Have you got the spelling?
Yes.
Okay, good. So please pardon me because I cannot type because in order to record the video. Okay. So people who are watching later on, they get confused and chat box is not available for them, and they cannot see the spelling. I'll try my best to write properly, but I'm writing with the finger, so that's why it's very bad written, It's not my fault. And there's no option of typing in the whiteboard. If anybody knows how I'll get the typing in the this whiteboard, please let me know. Okay, so let's start explanation. Shakti karma. So Shakti karma is like strengthening, okay, strengthening, giving the. So even if you are not sick, um, the yoga therapy you can still utilize. It's for improving your strength, physical and mental strength, making your muscles. Again, the yoga therapy gonna help you. Then for treatment, chikitsa means treatment. So Shakti means giving you physical power, making the muscles fit body. That for that also you can utilize the yoga therapy. Then for chikitsa is a treatment base. Uh, for treatment for any diseases, right? Mental, psychosomatic, or physiological or psychological problems, you can use the yoga therapy. Adhyatma karma means giving the it's not related to treatment, but basically it's for the spirituality. Adhyatma means spirituality. For spirituality, even if you're setting the goal, okay, I'm not sick, I'm also not looking for the muscular body, but my goal is spirituality. So also you can practice the yoga therapy. So yoga therapy basically for everyone. Everyone should know about the yoga therapy because it's helping you to improve your mental physical health. It's also, giving you the spiritual health and improving your lifestyle, improving your relation with the other people, and you also become more strong in the handling emotional up and down of your life. So yoga therapy is, and doesn't matter you are old or the kid, it's for everyone. Which started in the 1970s in the France with the name of that doctor is Dr. Bernard Oriel. He basically coined this term, yoga therapy. But he's not giving all this treatment. Yoga is very much old, it's 15,000 years old practice. But we never give it the name that yoga use as a the treatment. But yoga would be practiced by in ancient India. Yoga is taken as a attaining the moksha or liberation, or even for the treatment. It physical fitness automatically come when you're looking for the higher health. Higher health, what? Spiritual health. If you're spiritually healthy, you're emotionally healthy, socially healthy, psychologically healthy, and physically healthy. Yes, because everything is linked. So they never talked about that yoga would be using as a. They never use the term, but basically yoga, even 15,000 years old, it's bringing the peace and higher level of the health to the human being. Okay, so but the coinage happened in the France and by the Dr. Bernard Oriel. If you want, you don't require the name. Don't worry. I'm just giving the little information about it. How this term start.
Can I ask you something?
Yeah.
This is like a normal, Shakti Karma, they do massages and lots of things and chigals and Adhyatma. That's very normal in like Ayurveda and in especially in Ayurveda. I've seen I heard in ancestors they have doing it for centuries. So what is special about somebody giving a name, just like a different name? They might have used different names themselves. So this is like centuries old. Like why we specify like 1970, which is just giving a name. How does that matter?
It doesn't matter at all here. I'm just giving you that how this term start, used by the France, and then it's become popular in the rest of the countries. Even India started using the yoga therapy. It doesn't matter at all. It's century old, yes, that's true. Even the Dr. Bernard is not using the whole yoga. He's just using the meditation part for the treating their patients, and he took the yoga from the India, right? It doesn't matter at all who is using what name they are giving. I'm just giving you the history a little bit, how the name come into the existence. So that's why I'm talking about it. It doesn't matter that you should know about it or we should give the complete acknowledgement to them that they are the one who invented the yoga therapy. No, it's not like that. Our purpose
No,
to
I was.
give.
I just asked the question because I've seen, in my grandfather giving like the same thing, like, and he passed that from his ancestors for centuries, but they didn't give the sweet name. But instead of the
That's what I'm saying. We haven't given the name.
1970
That's
is
what I'm
very
saying.
young.
Yeah. That's what I'm saying. It's just they have given the name. That's it. They use the same thing, same method, which is century, 15,000 years old practice, and 5,000 years is the Ayurveda, and even many years old because they didn't come very later on. Earlier, it was orally done by the people. They memorize everything, so we don't know even the accurate date. It's very year old. But yes, they invented the term, so I'm just giving you the little bit. Nowadays even the people are start taking the patents of everything because they want everything is there, but they just snatching everywhere in order to get the name and fame or something like that. I don't know what is going on, but even today is also happening, and even the Asian time also it was happening. So they just given the name because they use it, and then even the Indian people, they are not acknowledging the importance of the yoga. It's West, it's the European country, it is the West who started acknowledging the yoga, and then later on it's coming. Even many foreigners, students, they are teaching the yoga to the Indian students. So it's born here, but we are not giving the importance. Only few people, even in my families, they never acknowledge the importance of the yoga and the yoga therapy and other things. They're just taking everything for granted. But yes, those who are giving the respect and everything, they just giving the name and they start utilizing and they get the benefit. So instead of talking about who is best, who is not, we are not going into that. That is a different thing. But we should focus on how we can treat. That is the most important thing. So dear, rather being I think we should not be waste more time on that. It's totally okay. They want the acknowledgement, that's okay. If they don't want, that's it, that is also okay. But our important is what, to focus on the treatment, how we can help the surrounding. Doesn't matter what caste, creed, what culture, color, because yoga is not limited in the, this is the Hindu religion is invented or other people are invented or something, is more than that. It's for everyone. It is a law of the nature. Everybody who is born in this planet, especially the human being, they get the benefit out of it. No matter who owns the patent of that, Indian peoples or the foreigner peoples, doesn't matter at all. We just looking for the answer and we focusing on the answer, way how we can help each other, especially in this pandemic situation. So forget about those things. Don't going in that direction. Now move to the again in here. Then this is the three. So even the spiritual health you will get by practicing the yoga therapy. And understand yoga therapy means including everything, even the allopathy also. Major portion coming from the Ayurveda. Yes, Ayurveda play very important role if we are giving the treatment to anybody. Okay, because moderation of the diet and what kind of person problem they are having, which personality they are having, which climate they are having, everything we have to understand through the according of the Ayurveda law, rule and regulation. Okay, that's why we studied the Ayurveda. Then Then we also including the Unani medicine, other naturopathy, which is naturopathy, or the homeopathy medicine. We also going to we will take the help of those things. Even allopathy, if there's a requirement of taking the allopathy, sometimes even allopathies keep going, and then we are including the yoga therapy to them also. So sometimes whenever I get the patients, like for example, some people are undergoing from the diabetic, they have the diabetic problem, so immediately I cannot stop their medicine, or thyroid or hypertension, and so sometimes they have to take the medicine. Along with the medicine, I'm giving my treatment, because it's not basically the medicine based, it's basically the lifestyle based. Okay, so yoga therapy approach is holistic approach, including every method to bring their health back. So we are not even discriminating. Okay, I'm gonna follow the only the Ayurveda. No, it's not like that. I'm gonna only follow the Unani medicine. No, I'm not. We cannot do like that. Or I'm completely renouncing the allopathic. No, this cannot be possible. So yoga therapy, so approach should be like that. It means including every method to bring the health back. So this would be the approach, and we utilize the all the method by observing the patient. And yes, the treatment is long term, it's not the short term. Minimum 4 to 5 month treatment should be given. Maximum it's 1 year, 2 year, depend how big problem they are having. If it's genetic disorder or it is inherent problems, then it will be it will can take the more than 1 year. But if it's like not genetic or inherent problem, then it's maybe they maybe those people can come out 5 months or 6 months. Okay, minimum 4 months. We give the we observe the patient 4 months, minimum 4 months, uh, in order to see the benefit on them. Okay, but yes, yoga therapy working on the root level. It's not the superficial level. It's not, we are not talking about the suppression of the disease. It's removing the disease from the root. So that's why we require the long term. Another scenario, the problems what we are facing in the giving the treatment of yoga therapy, because this is long term, and you require the very much discipline of your mind, especially the patient discipline is very much important in order for undergoing treatment, because mind is unstable. So people want quick result, and so that's why they're not taking the you know this treatment as a very first place. They go through every treatment, and then when nothing is left, then they come to the yoga therapy. The people come to me when they tried everything and nobody is able to treat them. Then they come to the yoga therapy, and then we work. So here two things you require. You require your, the person who is yoga therapist, the effort of that person and the patients. He has to put also the effort for the treatment. It's not like just by taking the pills, problem will go on. Remove problem remain in your body, and to working on the root level, we require both. So it cannot be attained in the bunch, like you go to the hospital, there is a queue in the clinic or in hospital, and doctor is giving the 5 minute and checking out. That's it. At least we, the yoga therapist, you know spend the time with the patient, psychological way, mental level, mental connection. They they develop between, and then they find, um, they basically start doing they started with the slow level treatment, and then they gonna increase after 15 days. They keep modifying if something not proper results are coming. So they they can modify the treatment, or they can bring a little bit change into that, or they can continue the treatment. So basically, under the observation of the therapist, the treatment go for at least 4 months. Okay, so this would be the approach. So I have given you the little bit idea about how this treatment helps the people and what are the scenario. You require full 100% surrender of the patient. If patient is not surrendering, this yoga therapy would not be, helping them out. Now, come to the treatment. So today we're gonna discuss about the bone related problems, and today problem is arthritis. So write it down, the arthritis, and how we can help them through the diet. So today we're gonna talk about the diet of the arthritis. Arthritis is the problem when some patient get inflammation in the bones. It could be based on, there's a many types of the rheumatoid arthritis. There's 100 types of the arthritis, right? Joint inflammation. But most common is osteoarthritis and rheumatoid arthritis. Okay, these are the two types of the knee. Don't go for the spelling. You can later Google on it. Don't worry about. Just understand and write it down. The most important thing which you require, especially the diet, what they have to go through it. Okay, so more than 100 types of the arthritis. Even the diet which I'm going to talk about, it's for the especially all kind of arthritis. Okay, so in arthritis, what happened? Sometimes arthritis happen because of the infection, which happen invasion of the outside virus and the bacteria, which inflame your joints. Okay, and some arthritis is autoimmune disorder. It means your white blood cells, you have the soldier who are fighting with your infection. Even the when mosquito is gonna bite you, there's a redness. Can you see when mosquito bites you, you feel the redness and inflammation? That is inflammation. And this inflammation happen because the white blood cells is fighting with the mosquito bite of the mosquito. So that inflammation is showing the fight between the bacteria and the white blood cells. The soldier is protecting your body. Small things will happen, your white blood cells is always ready. But autoimmune disorder, what happened? They get the wrong information that somewhere the bacteria invaded, and they start attacking it without even when there is no bacteria attack. And then it creates the inflammation, especially in the joints of your body, all the joints, synovial joints. So all the major synovial joints, I hope you studied in the anatomy, would be affected, and then it give you the inflammation and it affect your mobility. You are not able to move. It stop your movements. So when you move your body, you get problems. So how the arthritis look like, you can see through this picture. And we have 5 minutes, so I'll just show you the picture of the arthritis. You get idea about how it look like. So bone inflammation happen in your body. So can you see the picture? It started with the most early symptoms come with your fingers. So fingers become like this. Can you see this hand picture? Picture is visible to you?
Yes.
Yeah.
Okay. So what happened? Can you see this is the joints? So between the joints, it started with the fingers. Very early symptoms started with your fingers. You feel stiffness in your fingers. The symptoms, very important. Early symptoms, if you figure out, so you can cure early, right? So morning stiffness in your joints, and it's remained for 1 hour. It means more than 1 hour. It means there is a sign of the arthritis. Warm tenderness, pain in your joint, swelling you feel, range of motion is limited, then it means deformation. Your joints are deformed, and you have the burning eyes, itching in the skins, and you feel tingling and needles kind of sensation in your area around the joints, and your sleep is disturbed, then it means there's a sign of the arthritis. It could be any arthritis. Then you go for the test later on, and doctor do the blood count test or X-ray and joint water test. These are the name of the test, and then they figure out you get that arthritis or not. So inflammation in the bones happens, especially in all the synovial joints. Either it's autoimmune disorder or it's because of the infection. That you have to figure out by the test, medical test. Okay. So I hope its picture is clear. What is arthritis? So mostly two types: rheumatoid arthritis and osteoarthritis. We're gonna talk about. So tomorrow we're gonna talk about the diet and the treatment because we don't have much time today. So do a little bit more study about the arthritis. So if you get a little bit idea about it, how we can provide the treatment to all types of the arthritis and even the all types of the bone disorder. So keep your, if you have the queries tomorrow when we done the arthritis session, then and the bone related problems, you can ask the queries. Just note it down your queries. If I covered it, so don't ask it. If I didn't cover it, you can ask the question. Okay. So let's end the session with the one time Om and Shanti. Keep your back neck straight. Take a deep breath. Om. Shanti, Shanti, Shanti. Join your both palms around your palm. Place on your eyes. Very slowly while blinking, looking at your palm. Gently open up your eyes and say Om Shanti. Bye bye. Take care. Bless you guys. Meet you at meditation class. And write it down your queries. Don't worry about it. All the question will be answered. Okay. Bye bye.